Hi, everyone. I just want to talk a little bit about general wellness and things that are advantageous to you in trying to stay healthy. Now, many of us in the community, we have chronic conditions. Those conditions might affect our heart or our kidneys, maybe our blood sugar from diabetes. Maybe there are other conditions that we're contending with, like cancer, or we're on chemotherapy or radiation. Those things might affect our body's ability to fight the virus, which means that nothing is inevitable when it comes to that virus, but it means that we have to be especially careful about paying attention to the strategies to keep the virus, the conditions favorable to the virus, away from us, right? So if the conditions are favorable to the virus, they're not favorable to you. So you're going to adhere to some strategies that I've laid out in some of these other videos. The other thing is, to the best of your ability, attempt to adhere to health regimens that are meant to take care of those conditions. So if it's possible for you to adhere to your blood pressure medication, you should try to do so, even if you feel otherwise great. If you can control your glucose by adjusting or taking your medications as prescribed, or perhaps reaching out to a provider if you're finding that those medications aren't working well, it's in your interest to try to find ways to get that glucose under control. That will help your general health, it will help your organ systems, and by virtue of that, it will give you a leg up on staying fit, even if there's a tiny chance that your body experiences an illness such as coronavirus or any other illness. So those are some helpful tips. As far as other practices for wellness, whether it's meditation or spiritual or prayer, all of those things are very valuable during a stressful time like this. And they in no way can cause harm. They might really help us emotionally have some fitness and some solace and some comfort. There are some practices that some people perform, such as using a neti pot, which is cleaning out the nostrils. I would say the following, that right now during this epidemic, if that's something you've always done and you wash your hands carefully, I don't have a feeling about it one way or the other, but I would strongly discourage you from starting doing anything to manipulate your nose or mouth if you've never done it before. It could be inflaming to the tissues, and it could make those tissues in your nose, those cells in your nose, irritated, and that irritation and inflammation can make it easier for virus to enter. I don't know that for sure, but there's no evidence right now that that's going to keep you healthier. And if it's going to make you cough or sneeze, it could pose a risk not only to you, but to other people around you. So I would say that if you have never done that before, maybe avoid doing it now. Okay. Exercise. Exercise is a great idea. I think any amount of fitness is very helpful, but how you do it has to be determined by what are the conditions of your exercise. Where are you doing it? Who are you doing it around? And what are the conditions? If the conditions are favorable to the virus, a loud, small gym with some people huffing and puffing, maybe not wearing a mask, not so favorable to you, favorable to the virus, right? But if you're outside, you're doing similar exercises outside and you're spread out, then it's far less likely that that will be an issue. It's important to try to maintain some element of physical fitness so that your mind can feel well, your physical state is in good condition. And that doesn't mean that you have to start something new, but even just going for a walk, if that's available to your body, is worth doing. Okay? So that's a little bit about wellness. Take care of yourself and your medical conditions. Take care of your mind and heart. Take care of your body, but choose activities that are going to be less favorable to the virus. Okay.